So today's laboratory diagnosis of hepatitis hepatitis B infection. There are two types of important hepatitis that occurs in man is that hepatitis A and hepatitis B. Hepatitis A is RNA virus. Hepatitis B is DNA virus. Hepatitis A is RNA virus. Hepatitis B is DNA virus. Hepatitis A is fecal-oral. Hepatitis B is parental. Hepatitis B is parental. Hepatitis A is self-limiting without any complications, whereas hepatitis B gives rise to hepatocellular carcinoma. Hepatitis A is called as infectious hepatitis. Hepatitis A is infectious hepatitis. Infectious B is serum hepatitis. Hepatitis B is called as serum hepatitis. And hepatitis A is also called as infective hepatitis. And this is called as serum hepatitis. Serum hepatitis. And it is called as short incubation period hepatitis. And this is called as long incubation period hepatitis. It is called as long incubation period hepatitis. No, most of the patient who is suffering from hepatitis A do not come to the doctors. They go to the Ayurvedic doctors and they take some supported treatment, lot of carbohydrates, no fats. And now vaccine is available. It is called as Hbsag. And hepatitis B, I think almost all you must have taken hepatitis B vaccine, 3 doses. You start immunization now, one after 1 month, one after 6 months. So your antibody titer should be more than 100 IU per DM. That is called as uh, effective immune status against hepatitis B. Effective immune status against hepatitis B. So this is a common question that will be asked in your examination: hepatitis B and hepatitis A. Difference between hepatitis B and hepatitis A. Now coming to the what is hepatitis B? Hepatitis B is a DNA virus. It has got an envelope. Envelope is made up of Hbsag. Envelope is made up of hepatitis B surface antigen. Hepatitis B surface antigen. And it has got inside one more core, which is hepatitis B, hepatitis C antigen. One hidden antigen is there, that is hepatitis E antigen. And it has got DNA, positive and negative sense DNA, and hold this particle, this is, and it has got an enzyme called DNA polymerase. It has got an enzyme called DNA polymerase. And this whole particle is called as Dane particle. This whole particle is called as Dane particle. And hepatitis B surface occurs as tubular and circular particle. This is a made up of Hbsag. This is also Hbsag. Tubular and circular particle. This is called hepatitis B surface antigen. So this is a morphology of hepatitis B surface antigen. It is called as doctor's disease or healthcare workers disease. People who work in the hospital, they easily get infected with hepatitis B. Once you acquire infection with hepatitis B, you remain carrier throughout life. You remain throughout. It is very difficult to get rid of this virus from your body. Some people will clear, some people will. About 35 crore people are carrying this virus in their serum, in their blood. Equivalent to the population of US are carrying this virus into their blood. It is 1,000 times more infective than HIV. More infective than HIV. Almost 1,000 times more effective than HIV. Okay. Now this is a morphology of hepatitis B surface antigen. Okay. Now, what are the routes of transmission? What are the routes of transmission? So, from man to man, how it gets transmitted? I said this voluminous number of people carrying this virus. How to transmit it from person to person? Number one, blood transfusion. There are some infections which are called as TTDs. What is TTD stands for? TTD stands for Tirumala Tirupati Devasthanam. No. It is transmission transmitted infections or diseases. So remember, what are the transmission? Hepatitis B, hepatitis C, hepatitis HIV, malaria, syphilis, and cytomegalovirus. These are the infections that are transmitted by unscreened blood. There are these are called transfusion transmitted infection. Transfusion transmitted infection. The first and foremost thing, this thing is number two. It is needle stick injury. What is it? Needle stick injury. Uh, Anybody has given injection in this class? Raise your hands. Okay. After the giving injection, how to recap it? One hand technique. Although you should see that you have to lock one hand with other thing you insert. Once it is inside the cap, you should lock it. You should actually, it should, needle burners are there, you have to burn the needle. That's the ideal way. How do you dispose sharp edged needles? Huh? How do you dispose sharp edged needles? So I'll give a very good mnemonic for the hospital waste because very NABH accreditation that will be asked in your examination. Please come. White for sharp edged needles. White proof, puncture proof. White in Telugu, what do you call white in Telugu? And needle? What is white? Telugu? The Sudi, white? Huh? Telupu. Telupu Sudi, 10 times. Next is yellow. Yellow? Huh? Yellow dirty fellow. All anatomical waste and infectious material. And next is red. Red for parrot. Oh, you know that. I told you, I think. Good, good. Not necessary to tell. Black is non-infectious waste. Blue is for glassware. Blue for, I said, starry night and all that. Needle stick injury. Next, third one is vertical transmission. Mother to fetus during intrauterine life. Mother to fetus during intrauterine life. So, what are the infections that are transmitted from mother to fetus during intrauterine life? Huh? Now you remember with mnemonics torch. Torch. One is syphilis. Syphilis is caused by what organism? Syphilis is caused by which organism? Huh? Huh? What? What is that? Syphilis is caused by which organism? Gonorrhea is caused by gonococci, gonorrhea, Neisseria gonorrhea. Syphilis, Yersinia plague, Treponema pallidum. Treponema pallidum. Treponema pallidum. Then toxoplasma gondii. It's a parasite, protozoan parasite, Toxoplasma gondii. Man get infected by eating oocyst present in the feces of the cat, fecal. Then it is a mnemonic, rubella, RNA virus, it's called German measles, cytomegalovirus that belongs to herpes group, then herpes, hepatitis B, hepatitis C, and HIV. All these are transmitted by mother to child during intrauterine life. The most important is hepatitis B, mother is, and HIV also. So these are all vertical transmission, mother to child transmission. So you remember blood transfusion, needle stick injury, then vertical transmission. The fourth one is tattooing. Tattooing. Tattoo marks, all sportsmen, cricketers, they have tattoo marks. It should be done with sterile needles. If you get it done with roadside, very dangerous. It also happens with nose pricking, ear pricking. If you go to some roadside fellows, some people have pricking from here to here. So all you should be very careful when you go to the for pricking. So sometimes unsterile needles also can give rise to hepatitis B. Now what happens? It goes to the liver. It causes hepatitis B, and this virus remains latent for a long time. Afterwards, it gives rise to cirrhosis and hepatocellular cancer. What about their class? What class they have? No, theory class after this. Okay, thank you.
How many of you today actually supposed to come this batch? For that case. 52.
3, 4, 7, 7, 4, 11, 11, 4, 15, 16, 20, 20, 20, half 50%. No, we should be some severe action will be taken if you don't attend regularly. You'll be failed in the practicals. That is the best treatment. We want to make all of you good healthcare worker. I mean, allied health and specialists, so that immediately you get a job in some good hospital and corporate hospital. And should be knowledgeable. Knowledge is something. Once it is written in your grey matter, nobody can steal it. Money, jewels, diamonds, watch, everything, mobile phones, everything can be stolen. But knowledge is very important. You should not do such things. Okay? Attend classes. No, what's wrong in learning hepatitis B virus? Very important. Okay. Now, hepatitis. I said hepatitis B. Hepatitis B laboratory diagnosis is very important. No, most of the time I've seen your question paper. They asked ELISA, enzyme linked immunosorbent assay. Enzyme linked immunosorbent enzyme linked immunosorbent assay. Enzyme linked immunosorbent assay. Enzyme linked immunosorbent assay. Now, there are something called hepatitis markers. what? Hepatitis markers. You remember these antigens A, E, C. How do you remember mnemonic? You remember with some mnemonic AEC. There is any AEC. AEC you should remember. Uh, A for hepatitis B surface antigen. Hepatitis B surface antigen. And antibodies is antibodies to hepatitis B surface antigen. Then hepatitis E antigen. Antibodies to hepatitis E antigen. Hepatitis E antigen. Then this is a core antigen, hepatitis C antigen, and antibodies against C antigen. Hepatitis against C antigen. Hepatitis against C antigen. Okay. Now these are called hepatitis. Of course, you can sometimes this DNA of virus there will be viremia. Viremia. So these are called hepatitis B markers. These are called hepatitis B markers. These are called hepatitis B markers. Now coming to the hepatitis B marker, how they appear. For example, you make a graph, okay, like this, okay. This is the antigen, antibody titer, and this is first month, second month, third month, fourth month, fifth month, sixth month, seventh month, eighth month, ninth month, 10th month, 11th month, and 12th month. Okay. The first one at the end of 4 weeks, the first antigen that appears is hepatitis B surface antigen. Hepatitis B surface antigen. Hepatitis B surface antigen. As soon as the antibodies appear, this will disappear. Antibodies to hepatitis B surface antigen. And as soon as the antibodies appear, the antigen disappears. As soon as the antibodies appear. Now, next one is in the between second and third month, hepatitis E antigen appears. And antibodies appear. Antibody to surface antigen. Please remember, there is no hepatitis C antigen which appears in the blood. There is no hepatitis C antigen which appears in the blood. Around 2.5 months, hepatitis C antigen appears. This is very common question that will be asked in your examination. Now, interpretation, if you detect only hepatitis B surface antigen, then it shows active infection and is a carrier. To detect hepatitis B surface antigen, He is either actively suffering from hepatitis B or he is a carrier hepatitis. Sometimes he will remain lifelong carrier. If you detect both hepatitis B antibodies, surface antibody, he is recovering or vaccinated. Either he is recovering or vaccinated. Either he is recovering or vaccinated. Either he is recovering or vaccinated. If you detect HBC antibodies, prognosis is good. Prognosis is good. If you detect both Hbsag and Hbeag, he is called as super carrier. Only antigen, it is simple carrier. E and S are super carriers. 0.00001 ml of sweat, saliva, blood are infected to other person. Is called as 5 zeros. 1 ml is infective to other person. So all these markers are diagnosed by enzyme-linked immunosorbent test. Lot of students get confused. I'll make it very easy. What is ELISA? There are three types of ELISA. One is direct ELISA, indirect ELISA, sandwich ELISA. This is the microtiter plate. This is the microtiter plate. There, here, we are detecting surface. What happened? Huh? You are detecting surface antigen, no? We have to first code with the we have to code with the antibody. Hepatitis B surface antibody. Hepatitis B surface antibody. Then you add patient serum. And he has got antigen. Hepatitis B surface antigen. Then you put one more antibody, which is nothing but anti-human gamma globulin. Anti-human tagged with enzyme called horseradish peroxidase. Tagged with horseradish peroxidase. Horseradish peroxidase. Then you add substrate. If the antigen is present, then there will be color change. Color change. There is a color change. That is read by ELISA reader. This is also an example of sandwich ELISA. This is because two antibodies are sandwiched. Antigen is sandwiched between two antibodies. Now direct ELISA, the antigen is coated and you tag the antibody with enzyme and add the substrate. there will be color change. This is the direct ELISA. Now, indirect ELISA is the antigen is here, then you put the serum antibody which contains antibody which stacks onto the antigen. You put second antibody, that is anti-human gamma globulin with enzyme, and add the substrate. There will be color change. This is indirect ELISA. Indirect ELISA. So this is sandwich ELISA. Okay. First you coat with the antibody, then you add antigen, then second antibody, that is anti-human gamma globulin, tagged with enzyme horseradish peroxidase, add substrate, color change. Then hepatitis B antigen is positive. Then you have this direct ELISA.
I didn't understand.
Antigen is coated, then add antibody tagged with the HRP, add substrate, and there will be color change. Then third one is second antibody is used, that is anti-human gamma globulin tagged with the HRP. Antigen is coated onto the plate, add antibody, add second antibody coated with horseradish peroxidase, and add the substrate and color change, that is taken by the read by the ELISA reader. Is it clear? Any doubt? Any doubt? Any clear? Any doubt? Okay. This is how we do by ELISA, but nowadays we have got cards. They are called as mic stopped